All right, good afternoon, everyone. Welcome, and thank you so much for attending our November webinar. We are so excited to be here today and joined by Kate, who is from our mental health partner, BetterMynd. If you haven't done so already, we'd love to hear where you are coming from. If you'd like to put that in the chat. Before we get started, I'm just going to go over a few housekeeping items for today's webinar, which is extending mental health for holistic student support in rural communities. So the first thing is that we are recording today's webinar. So if you have to hop out early or you'd like to listen to it again, we will be sending out the recording via email, probably early next week to everybody. So you can listen to it then. You just have to keep an eye on your email. If you all have questions, and we love questions, please make sure that you add them in the Q&A. We are going to have a dedicated Q&A session at the end of the webinar where you can ask me any questions about Upswing, as well as our guest here, Kate. Additionally, we are going to be sending out professional development certificates via email. After our last couple of webinars, we've received a lot of requests for these, so we're just going to go ahead and send them out via email automatically to anybody that attends the webinar. So again, welcome and thank you so much for attending. My name is Elena Carroll, and I'm the VP of Marketing here at Upswing. So I wanted to, before we get started, because I know we have lots of new faces in the audience today, I just wanted to take a second and introduce Upswing to those of you who may not be familiar with us. So Upswing was founded in 2013. We've been around for a decade at this point. And our mission is to reduce the barriers for graduation for our non-traditional and historically marginalized students. We provide wraparound student services to colleges and universities throughout the United States. Our services include online tutoring, advising, writing support, mental health, and an SMS-based virtual assistant who we call Anna. So again, I'm just so happy to be here today and talk about this very important topic with you all. And I'd like to go ahead and introduce our speaker for today. So just a quick kind of background for you all. So Upswing has actually partnered with BetterMynd to provide one-on-one teletherapy for students. And we're just so excited to be working with the folks over at BetterMynd. They are so passionate about the same mission as we are in terms of supporting the whole student and helping them get to graduation. And mental health, as you will hear very shortly, is such a huge part of that. We know that academic support alone is not going to help students get to graduation day. It's really supporting the entire student. So I'm very happy to have here today Kate Wolfe-Lyga, who is the Vice President of Clinical Operations at BetterMynd. And I wanted to share just a little bit about Kate's experience because I just think it's so powerful to have someone like Kate here today to share her experience and the data and research that they have been collecting over at BetterMynd, but also really speaks to the testament and the quality of care that BetterMynd is really committed to offering our students. So Kate's career, as you can read here, has spanned the human services, mental health, and higher education fields for over 20 years. Prior to joining BetterMynd, she served as the Counseling Services Director for SUNY Oswego. In her time there, she secured and served as project director, led the department's successful accreditation efforts, and was awarded the Chancellor's Award for Excellence in Professional Service. Kate also served as president for the Association of SUNY Counseling Center Directors, the board secretary for AUCCCD, and served as a member of the SUNY Mental Health Task Force. Additionally, as if she's not busy enough, Kate owns a small private practice specializing in gender-affirming care. Kate's coming to us today from Syracuse, New York. As I said before, if you want to share where you're coming from, we invite you to put it in the chat. But I'm actually going to stop sharing now and let Kate take over because, like I said, she's just got a wealth of information to share today and really excited to kick into this topic. So go ahead, Kate.
Yeah, thanks for having me. I'm very pleased to be here as part of our new partnership with Upswing. I'm just getting my slides up, so give me a second. Okay, so yeah, I'm coming to you from upstate New York, and we are a balmy, I just learned, 56 degrees today after hitting some pretty cold temperatures this week. But I'm pleased that I am here to join all of you. I'm interested, Elena, I don't know, because I'm not sure if I can see it. Were we able to launch the poll?
I will actually launch it right now. So hold on just 1 second.
So I'm just really kind of curious about where folks are coming from in terms of their interest in this, because one thing that I found as I was looking through doing basically a lit review on this was that what it meant for rural college students is very ill-defined. And so I'm curious if folks are coming from rural areas and that's part of your interest, or if you recognize that you are serving students from rural settings, or both. Excuse me. But I'm really looking forward to talking a little bit about what we found through our BetterMynd counselors, and hopefully you can walk away with some ideas of things that you might be able to do on your campus to support our students who are from rural settings. Okay. So we're going to talk a little bit about the background for this conversation. So just some general context about why it's important for us to examine this topic, as well as this really being prompted by some interest in that CDC report, I think it was from April, related to suicide rates among folks living in rural communities. We're going to also explore the impact of the pandemic lockdown period. And then, as I said, we'll talk a little bit about our counselor survey, where we really asked our counselors for feedback about what they were experiencing with our students who were from rural settings. And then hopefully leave you with some ideas for follow-up. Okay, so the context piece. It's really important from my perspective that you have an awareness of what we're looking at, what the lay of the land with this is. So this piece around 59% of rural youth enroll in college after high school, it's relevant because comparably, we see 62% of students from urban areas enroll immediately after high school, and 67% of youth from suburban areas. Excuse me. There are 3.4 million students in rural community college receiving education from rural community colleges. And as I mentioned, this idea of rural is pretty ill-defined. There was a systematic review by Sowell and Crane in the journal The Rural Educator in 2021, and they found that rural was just not defined in 30% of the articles that they had reviewed. So for our purposes today, we're going to be a little bit flexible, especially because I understand that many of you might be here for different reasons, that you are serving students in a rural setting or you are serving students from a rural setting. So we want to make sure we're inclusive.
And
And
Kate, I can actually read off some of those results from the poll since we
that would be
just
great.
closed it, if that would be helpful.
Absolutely.
So we asked the question, what describes your interest in the topic? And 61% of respondents said that my college serves students from rural settings. 22% said my college is located in a rural setting. We have 17% saying none of the above.
Okay. All right. That's very helpful. Thank you. Um, excuse me. Okay, a couple other pieces. We do know that there are 260 rural community colleges across the US. And part of the reason for the attention on the community college in particular here is not that we're going to be solely focused on that and that there's not going to be implications for other institutions of higher education, but because the community college, because of who it's intended to serve, and also because of who often Upswing and BetterMynd are uniquely designed to serve, not exclusively, but uniquely designed to serve. We wanted to make sure that we kind of touched base on this awareness that we've got almost a few hundred across the country. Um, if I do use the word metro, I'm using that to be inclusive of both urban and suburban communities. Okay. So, in terms of the CDC findings, what we know is that in the 20-year span that they investigated, the completed suicide rate outpaced those increases in other areas. So, this approximately 19% was a pretty jarring number, and those were increases over the previous rates. So, you'll see, really, in some ways, a little bit of a chasm there. Um, One of the things that I think we don't necessarily have a tendency to recognize is that many rural areas are overrepresented with, and I put it in quotes, this non-Hispanic American Indian and Alaska Native people. So really thinking about Indigenous communities and the impact of the disparity amongst a lot of our Indigenous communities. So I think oftentimes most of our stereotypes lean on us assuming that when we're talking rural, we're thinking maybe middle America or Appalachia, or some of those areas where you often assume we're talking about white, conservative, Christian families, agriculture, some of those things. And I think we need to kind of expand our understanding of what that means to be a little bit more inclusive, particularly of Indigenous folks. And then this other little tidbit, that the emergency room visits for non-suicidal self-injury of rural residents were 150% times that of urban residents. So we just see these significant differences between those groups, and we don't have a lot of interventions to support attending to that issue. So we're not going to be specific about suicide as we talk through this, but this was kind of the impetus for this conversation. So a couple of things related to the implications of the pandemic on this. One, there were some differentiators that we did see. I mean, you can kind of see through here the areas of difference in the middle of the country. In some of these areas that we know to have more rural communities, we're seeing this density. They're darker in a lot of these areas, and where I think most of us might have assumed we'd see higher. Well, it would be darker along the coasts, because these urban areas, the contraction rates, all that stuff of the coronavirus was pretty significant. But when you're looking at the distribution across the population and you're looking at the rate, we're actually seeing much higher rates in rural communities. So I think some things that we want to be aware of as practical concerns in rural communities during this time were that folks had limitations in terms of access to telecommunication systems. So, you might be aware that In the last year, I think Congress appropriated $65 billion for broadband across the country, really with an effort to close the gap in a lot of these communities, but they're not there yet. So that is one thing that we're aware of the need, but we definitely didn't have the infrastructure to support it during this lockdown period of the pandemic. And additionally, some of the socioeconomic factors and being aware of the industrial factors. So we may have seen higher transmission rates during the pandemic because you still had folks who were working in some of the rural industries like meat packing or energy or some of those other areas that folks are in close proximity. They're considered I don't remember what the term is, but necessary workers. I don't think that's the right term. I can't think of it right now. Essential workers, excuse me. So those are some of the reasons that you might have seen a higher transmission rate because of those industries. Some of the things that, I don't know if benefits is quite the appropriate term, but that are really important to look at for us is that there were additional different types of economic differences related to unemployment rates, kind of that rebound that happened after the lockdown period or as we started to transition post-vaccination. And so we saw lower unemployment rates in the middle of the country. And part of it is because of the essential industries that are provided for through these communities. And certainly, I don't want to deny that political and cultural factors are likely to have played a role in folks' well-being in general in these communities post-lockdown. Okay, so when we decided to take a look at this, I had reached out to our counselors. We have about 470 counselors, and we had a just shy of a 20% rate of return. So we had a pretty good return rate. We did not use any kind of validated instrument. We just simply did a survey about their perceptions of the experience of the rural college student. And so a couple of things I'll share with you are that, because I'm not sure how many of you can read this on the screen, it's small print. For those who did serve rural college students during this health emergency part of the pandemic, we had 42 of our counselors, thought I had left these in percentages, but I didn't. 42 of our counselors indicated that the needs were different for these students. And in general, the needs of students living in rural areas versus urban areas, there was a significant perception of that difference. So not just the focus on the pandemic, but in general, the difference between these students that our counselors were experiencing. Excuse me. All right, so counselors identified some different challenges with the students. And I think some of those that I wanted to really highlight were food insecurity was a big piece of this. Although we might have assumptions about folks coming from agriculture, kind of more agrarian communities, what we're finding is that in spite of that, we do have still some food deserts in rural communities. We usually think of them in urban communities. But additionally, the prices are significantly higher in rural communities because of the transportation component of getting the items to the community is at least one component. So we had counselors who experienced a number of students with significant food insecurity concerns, housing instability, and increased uses of substances. In addition to that, they indicated a concern about students who their ability to access medical and mental health care. So beyond the work that they were doing with their counselor, if they needed a higher level of care or psychiatric intervention, those types of things, that students were very limited in what they had access to. And then lastly, just having stable connection through the internet to join their appointments, um, to complete their schoolwork if they were remote for school, and then the appropriate privacy. So one of the concerns in particular around privacy that, and I will say I experienced this firsthand in my work as a college counseling center director, was the component about LGBTQ identity. And so we had a lot of students who might have been out at school and they weren't at home. Not going to make any broad conclusions about this. This was just the experience, at least anecdotally, for quite a number of our students. And so this privacy piece, or at least a perceived limitation of privacy by students, was really an important factor in their well-being during this period. So many of our rural college students, again, if they were out, they may not be willing to explore some of that, reflect on some of that, and talk openly with their counselor about it during that time because of their fears for people in their household being able to identify that. Excuse me. So some other differences that our counselors noticed were social politics, religious identity, much higher rates of social anxiety. Again, these are anecdotal perceptions by our counselors, but I thought that was an important distinction. Social isolation, which maybe is likely to be highly correlated with it, and then dependence of family and social reintegration after the lockdown period and the return to school was much more difficult from their perspective on the student, on the rural student. Counselors perceived the following benefits, and I have a little caveat on this. So students' ability to go outside, certainly for any of you who serve students, particularly in New York City, and just I can share that just because this was my experience, again, as a college counseling center director. Students in certain urban environments really couldn't go outside, or at least there was a perception that they could not safely leave their residence. And so you might be in an apartment with 6 or 7 other individuals and really be kind of lacking in that access, where our students in rural areas perhaps were more likely to be able to go outside and do something outside during that time period. Perception of increased family support, that the family unit was a little bit more central to our rural students, that there were some tight-knit communities that were beneficial to our students, and that the church and religious affiliations were protective for many of our students. Of course, we know that's not always the case with any of these, but certainly for many of our students, it was a highly protective piece for them. Reduced exposure to stressors. So I think being away from stores that were closed down, having these things in your periphery was a little bit of what some of our counselors had talked about with this, and potentially fewer distractions. So one of the things, though, that I did want to know is that many of our counselors were unable to identify benefits or strengths or protective factors for rural students. And to me, that suggested that just kind of the bias that I think so many of us have related to our perceptions of rural student. I think there are often perceptions of folks living in impoverished, uneducated, again, back to kind of the white, conservative, Christian population being what many people default to. So I did suspect that we were seeing some bias relative to our counselors. And I feel pretty good about our counselor network. Suggested to me maybe there's some professional development here, but I think that bias that we might have seen here is something that we likely see in most places. Okay, so this I felt like one of the most important things for those of you who are working at colleges to be aware of. Um, in terms of rural students finding support, mental health support, while they were home during this period, the college and university was the number one answer among our counselors. There are a few other things, internet, family, and church and community, that were identified, but really this college university, which, to me suggests that there is really a lot of pressure on the college to be able to ensure that they're offering appropriate resources and helping students to navigate that, making it clearly accessible, all of those things. So I thought that was a really important, an important element identified by our counselors, because the implications for that for the college are pretty important. Again, back to the counselor perception. So this was kind of a forced choice, not forced choice, excuse me, like a checklist where most of them had identified, the vast majority of them had identified that the availability or accessibility of services was the number one barrier to our rural students, and the cultural factors and norms and social determinants took close seconds. So I think that this availability or accessibility of services is something that there's a little bit we can do about it in a really tangible way, but something we'll talk a little bit more about. Excuse me. Okay, so I'm going to talk more broadly about what we're seeing currently done in community colleges who are serving rural students and are also in predominantly rural settings. And so we're seeing some financial retention support. We saw that, I'm trying to remember when this was from. So this was published by EAB, and Pueblo has an individualized support initiative with financial aid. And so they saw significant retention associated with that. Seminole State worked with a local bus company, and they covered fare. So in terms of transportation support, they used the student activity fee to help provide this access to students. And then I think they created an additional bus route, and made the times more accessible and consistent with student schedules, that type of thing. So Pueblo, in terms of the transportation piece, they also provided these scholarships for gas, maintenance, and repair costs. And then lastly, Seminole, again, they brought classes to the community. So when they found that they had 15 or more students signed up from a specific area, they found places to host classes, host offerings of those classes when they were more than a certain distance away, and they had the capability of bringing that into the community. All of those were saw some pretty significant retention benefits. Excuse me. So that's kind of the background. I really couldn't find anything other than one community college that referenced anything that they were doing specific to rural students and mental health support. And that was really just about community awareness. So I didn't find any tangible recommendations or programs out there. So here's what my kind of my input is on this. This self-awareness and interpersonal piece feels like probably I don't want to say the easiest, the simplest, and the most attainable for any of us to really be aware of what bias we might be bringing into this when we are working with a rural student or thinking about a population of rural students who are going underserved. And the stigma, I didn't address in the previous slides, but the stigma in rural communities regarding accessing mental health support is often more compromising to students than it is in other communities. It's not always normalized, and in many ways, I think there's a practical reason for that. If we see higher engagement in um, religious communities, and or we see higher engagement with the family, the expectation of some of those in-group behaviors would be that you seek help within that group and not outside. So it's not inherently bad, but it's a barrier for our students, because this idea that you don't do that, that it's a problem, that these are strangers that you don't connect with, it's not normalized for them, certainly would reduce help seeking behaviors. Uh, really being aware of some of the disparities that exist, again, because I think we have so many folks who have perceptions about who is the rural college student, we are missing other underrepresented groups. And really, we start to see the impact of intersectionality come to life within this group. Again, not a group that we're always talking about when we talk about things like intersectionality, or the idea that we have these intersecting identities in which we are more privileged or less privileged than others. Excuse me. Community awareness and psychoeducation. Now, this may not feel like it is that heavy of a hitter in terms of recommendations, but probably one of the more important things that you can do on your campus. And so this idea that the college was the student's primary connection to resources, again, that's a pretty heavy load for the college to bear, and critically important, and an opportunity. So being able to ensure that the resources are visible and accessible to students is, I will say, I think I've definitely talked to a number of colleagues about the challenges of the finding resources on a college website, because you often have siloed programs. You often have kind of this concurrent experience of people wanting to put the information out there, but not necessarily marrying any of it. And so it can be really confusing. And having some sources of truth, so to speak, for students to access when it comes to different types of supports. And that's going to be inclusive beyond mental health. If your basic needs aren't being met and you need to meet those first in order to, in some ways, be safe enough to meaningfully attend to some mental health concerns you might have, that's where the focus needs to be. And so making sure that those resources, those basic needs resources, and then other health and educational related resources are available, preferably in a one-stop shop, but nevertheless that it's easily navigatable for a student is really important. And then this idea of a strengths-based approach, given the bias that is experienced by so many when it comes to the rural student experience, being able to leverage some of the strengths or protective factors or whatever that might be for the student is really important. And so not being able to focus beyond what some of the disparities might be, or what beyond some of the challenges might be that's unique to this population. And it also reduces the risk of some of these imposter syndromes and some of those things that also keep students from persisting in college and from help-seeking behaviors. There is a desperate need for research in this area. Much of the research was really outdated. And so a lot of what I found that was published 2020 or later really wasn't inclusive of the impact that the pandemic had on this. And so I think it's really critically important that we find a way to encourage inclusion of this group, rural college students, in the research, whether it's highlighting the settings that folks are coming from, or research that is centered on the rural college student experience, and their mental health. Um, One other thing about that is that idea of defining what rural means. So there, again, 30% of the articles that were reviewed um, by these folks in Rural Educator were had no definition of it, and so we didn't really know what it meant. Was it that they were attending school in a rural setting? Was it that they are living in a rural setting, and is that rural setting have some shared identity of their certain distance from a town or whatever that might be? So those are really important considerations. We don't really know the extent of the pandemic impact. So in terms of if you were to look at the criteria, using symptoms, criteria for mental health disorders, and you wanted to compare those, we just don't have any of it. So those are things that I think are important for future research. Excuse me. And this idea that we have more opportunity to marry basic needs and mental health. So, and some folks, of course, will consider mental health a basic need. But if you want to get into food security, housing security, um, access to healthcare, transportation, some of those things, and you can use those and correlate with mental health intervention, we have an opportunity to kind of wrap around care for these students. So I think those are just really important things. And one of the things, I didn't intend for this to be any kind of pitch for what my company BetterMynd does, but we offer teletherapy, telecounseling for we partner directly with colleges and of course Upswing to provide these services, and it's primarily the service is primarily the 50-minute video-based therapy session. And so the role of the teletherapy provider is critically important, having virtual options for students, especially as hopefully we close some of those gaps in terms of access to broadband and internet access in some of these areas, that has the opportunity to hopefully even out the impact of a lot of the distance and the challenges that these students experience. Excuse me. So I am going to open it up for questions right now, if I can remember how to stop sharing. So I wanted to leave quite a bit of time because, again, I didn't really know who and how you were coming to me with what expectations, and I'm hopeful I can provide some responses.
Yeah, thank you so much, Kate. Really appreciate all of that wonderful information. We do actually have some questions for you. So just going to kind of start at the top of the list. And again, if anybody would like to ask Kate any questions at all, please post them in the Q&A and we'll be able to get to them. So the first question that we have says, I've heard some students worried that the care won't be the same if it's teletherapy. Can you please speak to that? What do students say about their experience? For us skeptics out here, just nice to know because it's a trend that we need to serve.
Sure. So I'll be really direct about this. There is a difference between teletherapy and an in-person experience. I'm not going to pretend there's not. And particularly with college, I think one of the things that's really important for BetterMynd is that our college partners understand that we really want to support them at being primary. And so we understand that if they have a college counseling center, those college counselors can navigate and access resources in a way that our counselors aren't going to be able to do as fluently as they do. So I'll start there. I think kind of for lack of a better word, the foreignness of experience of teletherapy might be really challenging for people. But I think generally speaking, the quality of care is comparable. And perhaps at times exceeds that of an in-person experience, just because I think in many cases, folks get down to business a little faster in an online setting. Excuse me. And in addition to that, so the same service is being provided. Obviously, it's being provided one-dimensionally, but it is the same service that's being provided. So during the pandemic, when these things started to get to be studied, what we found is an equivalent treatment outcomes during that lockdown period where there was no choice. And so I think we have enough that suggests to us that teletherapy is a solid option, particularly to provide access to people who might not otherwise have access. So again, going back to the College Counseling Center, most college counseling centers are open traditional business hours during the week. Teletherapy, at least through BetterMynd and certainly some others, but teletherapy offers people some more flexible and convenient hours that might fit a schedule better, particularly non-traditional students or students who are online, remote students, whatever they might have a full-time job. Being able to be inclusive of the needs of those students is something that teletherapy allows for.
Thank you. I actually think this next question is very related to that. Any recommendations for serving students in rural communities who are attending college online across the country?
Yeah, so I'm going to come from one angle on this, but happy to hear a little bit more if this doesn't really answer the question. I think ensuring that the college is attentive to the needs of the students that they have recruited, that they have admitted into their programs, when they are not members of the community that's the college is located in. So for the online learner, we know that often people are seeking online learning because of things like working full time. They're often non-traditional students. I don't know if we're really even supposed to be using that term anymore, but I think we all know, we have a shared understanding of what that means. And so there are a number of factors, of course, like being attentive to childcare needs of those learners, the hours and availability of services for those learners. So I really think that, again, teletherapy is a good option. And I'm not, again, my intention is not to pitch BetterMynd services, but teletherapy and some of these virtual solutions for students, certainly the services that Upswing offers because of the hours expansion that's provided to students is a really critical, important piece of what gets offered. And so honestly, I think if you have those services on your campus, being able to do a really good job publicizing and making sure students are connected to those services. And at times, perhaps you're prioritizing the online student to receive some of the marketing information about what's available. Or maybe it's something that you are hosting directly from the college that you're not using one of your partners for, but you want to be especially attentive to those online students and creating access for them. So you're providing some direct marketing for them ahead of other students who might have other types of access that they don't. And I have a little dog barking outside my door who doesn't take the hint, so excuse me.
You're fine, Kate. Yeah, thank you so much for sharing that and giving us that answer. I do have another question from the Q&A that I'd like to read off to you. It is, with the increase of student needs and the limited counselors and services available on many campuses, what apps, training, or materials can you suggest to train staff to be gatekeepers?
Great. So I'm going to assume that this is gatekeeping related to suicide prevention. There are quite a number of gatekeeping programs or bystander intervention types of programs. So I'm going to rely on the suicide prevention gatekeeping. But there are a handful of programs that achieve this. And really, I think one of the most important things is to remember that staff and faculty, not as often is it the counselor. So faculty and staff who have more natural relationships with students, they're in their classrooms, they're a tutor, they're an advisor, whatever it might be, for those folks to be able to appreciate that their connection to the student is more readily available, then the counselor is really important. And it doesn't mean that those folks need to be trained to serve in lieu of a counselor. And I think sometimes faculty in particular, can express concern about that, oh, I'm just sending them to the counseling center because I felt like I was getting into territory I'm not trained for. So gatekeeper trainings such as Safe Talk and QPR and Assist, there are a few of them out there, can all be really important for general faculty and staff to participate in. And really what it does is it reminds us that we can have conversations with people, because you get to be a human first. And so that intervention that you can provide just by being a person who takes a little time to listen and then maybe does a warm handoff to somebody or helps somebody navigate resources, is really important, rather than just kind of exiting somebody from your door and sending them directly to the counseling center. So I think that's one of the ways, and I'm glad that you had mentioned the gatekeeper trainings, because I think that they can, again, sometimes it's certainly that they'll provide kind of a process for people to engage in when they have very specific concerns, but it also just reminds us that we can have hard conversations, and we can ask difficult questions and those types of things. Excuse me.
Great, wonderful. I actually have a question here from the Upswing team. We were curious about. I think that one of the things that you hit on quite a bit was the stigma around mental health within rural communities, and you kind of explained that oftentimes it's very natural for students to kind of go to their maybe their family, their community, their church, or whatever, to seek help kind of inside their bubble before they're kind of going outside and seeking help there. Is there anything that you would share that you've seen be successful to help maybe educate or just make that process a little faster if a student does need help, that they're seeking it when they need it? So kind of overcoming that stigma. I was curious if you could talk a little bit about that.
Well, I think one of the things, obviously, that we know on college campuses that can be really difficult is competing for students' eyeballs. We have a lot of marketing saturation that students receive. However, I think it's really important that, to the extent possible, the idea of mental health services is normalized as frequently as possible. So faculty being able to integrate it into a syllabus, or having the resources available in just really wherever you can in terms of the information of how to connect to support. I think where appropriate, being able to provide information to the community that students are coming from. I think this is probably a little bit easier in some ways in a community campus or community college setting, but just because you see much more diversity in terms of where students are coming from. But I think for kind of more of the traditional learner, the parent focus of the orientation and being able to normalize that for the guest or parent who might attend. So those might be some of the ways, but I think having that come up as frequently as possible inherently normalizes it. And then perhaps considering some social norming campaigns associated with it as well, that, I'm a student here, I went and saw counseling for this reason, it was useful because, and those things being publicized on campuses as well.
And I think this goes back to your earlier point, that kind of word chart that you showed, that says that schools are really kind of part of this, where students turn for help. So I think that's wonderful to add those things. I guess one final question. Again, this is kind of coming from the Upswing team. You talked a lot about self-awareness as well as bias related to, what our perception of a rural student is. And I was just curious, like for, all of us out there that are trying to be, better about these biases and be more aware, like what sort of things can we do to just maybe check ourselves, get more information, and really just make sure that we're thinking about these things in its totality and not just our own perceived biases of what a rural student is?
So without kind of invoking any formal resources, certainly folks being able to read or participate in events, those types of things, professional development is wonderful. But I happened this morning to be listening to a behavioral economist on a podcast, and this idea that we kind of check our work. So somebody asks us responds, and we have an awareness that, wait, why do I think that? What tells me that? Where's my evidence to suggest this? Those are, I think, some of the things that we're not finding that we're doing as frequently. Yeah, we're in a really fast-paced world. We have a constant influx of information. It's really difficult to filter, but that curiosity in and of itself can be so protective for us as professionals, that I think that alone can really mitigate some of the harms that may come from some of the bias that people experience. So I would say for folks to just start there, is just be curious. Why do I think this? What tells me this? Where's my evidence? And then that might prompt some further investigation to suggest that maybe my thinking is a little off on this one, or I have to broaden myself to think differently about this.
Wonderful. Thank you so much. I think that will be probably the end of our questions. So I just want to thank everybody again for attending today, as well as Kate for having you join us, because I've just learned so much from, just listening here today. And I just very much appreciate your time as well as the time of everybody that's attended. So I want to thank everybody for coming today. Again, just a quick reminder that we will be sending out the recording as well as professional development certificates as our follow-up items to our attendees today. So you can expect that in really the next few business days. So you'll see them next week. I did want to just also do just a quick reminder about the Upswing and BetterMynd partnership. We're so excited about working with BetterMynd again to really impact the entire student and help more students attain their goal of graduation. So we're just very excited to continue to be partners together, and sending out, of course, more information to all of you about that in the coming weeks. So if you would like to learn more about that, or you have any questions about today, please do not hesitate to reach out to us. I have an email here that you can contact us. We'd be happy to put you in touch with the right person. I also want to do a little plug for any of our Upswing partners that are out there. We are offering a free mental health webinar for Upswing students on November 15th. At 8 p.m. Eastern, we're going to be bringing on one of the BetterMynd counselors to talk about stress and anxiety and how to cope with those feelings that, often are happening this time of year for our students because of all of the, pressures that they have going on in the semester. So really excited for that one. So if you'd like more information about that as well, don't hesitate to reach out. If you need any